Live from the I-10 corridor, it's the Dave Nemo Show.
Tim Aschoff from Shaffer and Crete joins us here in just a moment, and he and I were just talking very briefly during the news. And he says, hey, what are you kind of having a health morning this morning? I said, well, Tim, that kind of almost happened by accident, but we did have our Highway to Health with Claire Marie on COPD. And then I ran through the thing on sleep apnea from the law firm so that you would kind of get an idea of where that world is coming from in terms of driver health, specifically in this case, sleep apnea. But as promised, we're going to talk about insurance here in just a moment and the importance of health care coverage in the trucking industry. There are a lot of factors that are being pulled into that salad bowl and getting mixed up. And there just has been an election, of course. There are some programs that are being looked at, if you will. There are some other vital factors out there that we need to talk about. And Tim is going to cover a lot of those bases with us here in just a moment as we visit with Crete and Shaffer here this morning. And now, the president of Shaffer, COO of Crete, our good friend Tim Aschoff. Hey, Tim, good morning.
Good morning. Great to be here. It's hard to believe it's December already, and this year's almost in the can, as they say.
Yeah, indeed. Some little doors have already been opened on those little advent calendars, you know.
That's right. My kids are excited to do that every day and get that chocolate out of there.
Well, as I mentioned earlier, it's almost by accident that this did turn into sort of a health morning here on the program, but that's a good thing. But, man, you know, what I was mentioning early on in the show, sort of an editorial. You know, you have health issues and regular folks who work the 9-to-5 type jobs, you know, they take health at its face value. But in the trucking industry, there's always that extra component of mandates and rules and regulations and hoops that are, you know, sometimes flaming that drivers have to go through. And there's always this clash of contingencies that hit drivers all the time. But one thing that hits everybody is health care coverage in the trucking industry. It's exceedingly important. And that's kind of your ballpark, isn't it?
It is, and we've recognized for years how important that having good health care coverage is, not only for, you know, the drivers out there and themselves, but also for their families back at home, to give those drivers peace of mind, knowing that their family's taken care of back at home. But to focus on the driver, you know, you've talked about a few things earlier this morning with sleep apnea and COPD. As the drivers know, with the medical DOT physicians having to be certified now to do the medical exam, I'll say they become, you know, much more thorough in their exam, and the level of health, you know, required to pass that exam seems to have maybe been ratcheted up in recent times. And, you know, in some ways, as we all know, and it can be frustrating, certainly for a driver at the time, but overall that's good because, you know, your long-term health is very important. But we all know that DOT physical is just a small part of getting health care. That's just a you know, check at that point in time. Having good health care coverage for you to have good access to good preventative care, regular care over time is what going to make everyone, you know, healthy and successful and be able to stay a driver for a long time. So that's really what we focus on in our program, is providing, you know, quality health care access across the country, because we know that's what you need, and then at that affordable weekly rate. And certainly, as we all know, with what was coined the Affordable Care Act, I'm not certain how affordable it is, the last couple of years, and just the rising cost of health care, you know, that's been more and more of a challenge. And I think more of us as individuals have to focus on that, because it's becoming a bigger part of our, you know, weekly and monthly costs out of our own personal budgets.
Tim, you mentioned the Affordable Care Act, and of course that's been one of the real talking points in the election. Are you hearing from some of your folks? Are folks a little concerned about the sensitivity of this issue? There's a lot of question marks popping up over folks' heads in the fleets.
Yeah, we're hearing about it from a few different ways. First of all, as we've all heard, a lot of the exchanges out there have reset their premiums for next year, and there have been some huge increases. From 10 to 75% of premium increases depending on what state you're in, and so a lot of our drivers are concerned. Then is what does that mean for us? So that's one element of it, and then certainly then it's okay. Well, now that we're going to have a new administration in with President-elect Trump coming in, what's going to happen going forward? And I think everyone knows that we need to continue to have a mechanism for healthcare to make it affordable and make there be access. And certainly, it doesn't appear with what we've had in the last 5 or 6 years that that's really been the case. So I don't know that any of us really know exactly what's going to happen in the next couple of years with respect to changes the new administration may make, but certainly we all know we have to try to keep that affordable access there. And as a company, we're somewhat in between because we're wanting to provide that for all of our employees, but then have to follow the mandates that the government provides out there. So we're kind of sitting on the sideline too, trying to figure out what direction it's going to go. But certainly know that 75% increases in premiums aren't sustainable. So we need to work together, industry with the government to try to get a workable system, but then all of us as individuals and really managing our own healthcare and our own healthcare costs to try to keep it affordable as well.
It costs a lot. We'll kind of talk some of those dollar figures here in just a moment. You've got some notes here for me, and it ain't cheap. But Accenture did a study that you guys looked at about what folks consider to be vital in terms of staying with a company. Obviously, the way folks are treated, the way they're paid, and things like that are way at the top of the list. But I kind of remember almost, and I've been around longer than you have, Tim. Been around longer than most now, and I can remember when health insurance wasn't that big a deal in the industry for drivers, but now it's become one of the main things. Have you seen sort of a shift in emphasis in terms of the importance of it in folks' minds in terms of staying with a company?
We really have, and for some of the reasons we just talked about. But as we talk to our drivers and ask them about what's important to them, that healthcare and overall benefits come in generally in the top 3 now, where in the past it may not has been important. And I think part of the struggle with in the past as to maybe why it wasn't viewed as important. Healthcare is often hard to figure out really what you as an individual are paying for cost of coverage, and can be fairly complicated. So, I think what a lot of us look at is, well, how much are you going to take out of our weekly paycheck? And that's about what we think about, because we all think we're going to be healthy. We're never going to have any problems. And we forget to look at, well, what's the deductible? Is there a copay? What's the cost of co-insurance? And so now as healthcare has become more expensive, and I think we all as individuals are seeing that we're realizing more of that cost, I think we always felt that we needed to be healthy over 10, 15, 20 years. We all wanted to be healthy. But as that cost has increased and that's become more down to our own individual pockets, I think it's become much more important to understand that healthcare coverage and really the intricacies of it too, because as you know, just that premium that comes out of your paycheck every week, well, that's very important. There's a lot of other aspects to that can cost the individual a lot of money over a year's time should you have a health issue.
Yes, and I just want to, once again, not to continue to belabor the age component here in our conversation, Tim, but when folks get into Medicare, and a lot of our listeners right now have gotten Medicare, those copays, they go up every year, and they go up by a pretty nice little chunk of change. So there's no escape at 65 when it comes to how much stuff is costing, right?
That's right, and I think the best thing to do is be educated about it, because the last thing you want to do is be surprised when you have a medical issue, or you go to have a procedure or otherwise, and you do the important thing and you get your health taken care of, but then you get shocked by what the bill is a couple weeks later, and so often there's not too much you can do about that, obviously, but certainly being aware of what your program is, how it works, and what those co-pays, deductibles, and other things are is very important, because you need to be prepared for that.
Now, you've taken a look at some of the numbers from the Centers for Medicare and Medicaid Services. Kind of run some of that by us, Tim.
Yeah, right now, as I talked about, healthcare is becoming a bigger and bigger part of each of our own personal budgets, and the recent information shows from Medicare and Medicaid that the average American now is spending about $9,600 a year on healthcare, and that includes the premiums you pay, but that includes those co-pays, those deductibles, the cost of medications and things that go along with that. And if you think about that, so our average driver, for example, makes about $60,000, and that's close to 15% of that income on an annual basis, and so that's a pretty good size chunk of that. You used to not think about using 15% of your income on anything except for like buying a house or maybe a nice automobile, and now you're spending that on your health care, and the scary part, as we talked about, is, and you mentioned with Medicare too, is it's going up every year, and that's projected to go up 50% over the next 6 or 7 years, to over $15,000 a year. So this is something that it does impact us all, and we need to be good consumers of health and know what's happening out there.
I want to kind of zero in on you guys here. We don't normally do this when you and I talk. You generally like to keep things industry-wide, overall, with a broader picture, so to speak. But I want to kind of zero in because I think the best way to talk about this particular issue, when you talk to your drivers, where does insurance rank in, and how does that affect turnover?
For our drivers, it ranks very high. As I mentioned earlier, it's generally in the top 3, and depending on the driver, it can be the number 1 issue because of whether it's their own personal health or health of a family member. They know having that good coverage and limiting that out-of-pocket expense, as I mentioned before, with the average being close to $10,000, that can vary a lot by the plan you have. So us, having, our goal is always to, have a driver, hire a driver, good qualified driver, and keep them forever. And so our health insurance and our benefits packets are designed for that. We want you to be here and want you to be able to afford to stay here forever. And to do that, we have to limit that total out-of-pocket expense you have for healthcare coverage. So we not only look closely at the premium we have for you on a monthly basis, but at maintaining low deductibles. Our single deductible is still $1,000, which is pretty low out there anymore. Our family deductible is $2,000, and we work hard on that because the cost does go up, and even if your deductible is not going up or your premium is not going up, then it's going up for the company. We here at Crete, we're really self-insured on our medical plan, which means we pay Blue Cross Blue Shield to administer our plan, to give us and our employees access to medical services across the country, but the company then pays all the full cost of whatever the employee's portion isn't. So when we have healthcare costs go up, we have to decide: does the company pay more, does the employee pay more, or do both pay more? And so that's a tough balance because we have to be able to continue to afford to be in business, but also provide the strong benefits needed for the employees, and having long-term drivers, we do talk with them about that and work through that balance with them, and because it's so important to them, we focus a lot on that as part of our overall package for our drivers.
So you guys have made a decision about that, though.
We have, and we have to every year in about August, we have to work with our providers and say, well, what will the healthcare costs be projected to be next year, and then how do we cover those projected increases? And we went through this last August, and as we've seen projected increases, we made the positive determination to say, what, medical costs and healthcare costs are high already for our employees. And we know that it's a challenge for everyone, the trucking industry in particular. To be honest, as 2016, was a little bit of an off year for trucking. Certainly not as good as 14 and 15. Now, recently we've seen it come back, which is great, but we know that it's been a little bit more struggle out there. So we said, what, we're not going to change our healthcare premiums. We're not going to change our deductibles. We're going to make that positive decision that any cost increases are going to be taken on by the company. And that's really is that investment into, our employees, our drivers, the office staff, our mechanics, technicians out in the field. And that's just something we have to make that decision on every year and know that it's important to not only our employees, as I mentioned, but their families.
You also give... excuse me, I thought I turned the mic off for that. You also give... you have those 4 levels of coverage. Why is it important to have, that type of program?
Well, I think maybe what you're referring to is that the Affordable Care Act has designated out there that programs fall into one of 4 levels. There's the platinum level that I don't know if people remember when the healthcare debate was going on. That's where they called them the Cadillac plans that were very high benefit plans that are going to be taxed at a higher rate because they're really out there. And then there was the gold, silver, and bronze plans. And so what you have to look is where do your plans fall? And our plan falls as a gold plan, which means we as a company pay at least 80% of that cost of overall health care and provide reasonable premiums, deductibles, and then good access across the country. And employers can kind of look and decide where do they want their plan to fall in that range. And again, as I certainly said, the platinum plan is actually a negative as you actually get taxed more on that. So the gold plan is what we feel is the sweet spot. It's the best plan you can provide without that platinum tax and to the employee and to the employer. So we've worked hard to keep that gold plan out there and to keep those levels of benefits and level of care. It does mean increasing costs for the company, but it means those continued benefits at a reasonable cost for our employees. So I just encourage you as you look at your plan, this is open enrollment period. A lot of them are just wrapping up, that, look at what level of plan you have so you understand that. That'll tell you, what your individual costs are going to be over this next year. But also, I'm going to maybe get off the core subject here a little bit and just give you a word of advice. Please, please, please pay attention to that Your Open Enrollment booklet. I know that we all get open enrollment information mailed out there. It's generally about 30 pages of a lot of things that's hard to sift through, but is so important to you and to your benefits for this next year. Due to federal and state regulations, this is often the one time a year you can actually make changes to your benefits, whether that's electing to add some coverages or to decrease coverages. This is the one time you can do it. Also, many employers like us have what's called a flexible spending account, where you can have money taken out of your paycheck pre-tax and put into an account that you can then use for medical expenses, your copays, your deductibles, some medications, those types of things that come out of the account, and then you never have income tax on that or employment taxes on that. But you have to elect that every year during open enrollment. So a lot of things are important in that open enrollment booklet, and I know I think one of the things the regulations have done in this world is created that we send out way too many notices related to our health care plan that we all get so many in the mail, we just don't read them anymore because they're hard to read, hard to understand, and it seems like I get one every 2 weeks. So this one is one you shouldn't ignore, and make sure you make a conscious decision about your health care plan for next year.
One of the real cool things about the plan that you guys have is in fact, When I come home from the gym every day, I see a big billboard for one of the local hospitals. See a doctor online. You can talk to a doctor face to face on your cell phone. You guys have that. It's called Telehealth.
We do. We added this last year in 2016 because obviously, the drivers out there have a hard time, getting access to their own personal health physician, whether it's because of schedule, out on the road 2-3 weeks at a time, or even just access, parking or otherwise. And so we worked with Blue Cross Blue Shield and have added this service where our members are able to sign up through a web portal to basically set an appointment with a physician that then they can, basically have a video conference with, and they're able to do, most of what you can do in having a personal visit with a physician. Technology is pretty amazing. I've talked to some of our employees that have used this, and they said, "Yeah, I took my Apple iPhone and I was pointing the camera down my throat, and doctor was diagnosing me, looking to see if I had strep throat or other things." And he said, sometimes you have to stop in then to a quick clinic and have a little bit of other testing, but for $39, it's a one-time copay for that telehealth service. You can have a doctor's consult on your schedule at your location, and we found that very beneficial for some routine healthcare things. So I've got that. Potentially have that ear infection. I may have that sore throat. I've just have been in a funk or something like that, and it's been a real advantage to particularly our drivers.
Yeah, that is very cool. I mean, that is just custom made for truck drivers, telehealth, although you can't have your DOT physical done that way.
Nope, not yet.
Not yet. I think that may be the key word there, not yet. Lord knows what's coming next, right?
Yeah, technology never stops to amaze me. It's every year it continues to evolve and be able to give. I think it's just great for the trucking industry. The positive benefits it can have. Yeah, we always think about sometimes the negative it can have because it may take some of our freight away or otherwise. But certainly, the positive lifestyle impacts for drivers is great.
Indeed. Tim, it's always great talking with you. And again, we generally keep our discussions much more broadly based, but I really wanted to kind of zero in to give a real life example of how good insurance coverage can be in this industry when a company really works hard to make it so. The gold standard, hey, they don't call it the gold standard for nothing. Speaking of gold, though, a little more gold in drivers' pockets, you announced that pay raise last week.
We did, as I mentioned. An overall package for our drivers is very important, and while healthcare is a big piece of that, just overall pay is as well. And we've always tried to be a leader in pay for over-the-road drivers out there, been top pay certified for years. And as I mentioned, this has been a little bit more of a challenging year for drivers and for the industry as a whole. But we see really positive things on the horizon, and certainly want to reward those drivers that have been with us through this challenging year, and certainly attract those good quality drivers out there for the future as well. So we announced across the board pay increase for over the road drivers of a penny that'll be effective January 1st, and certainly encourage everyone to use this time of year to reflect on their overall package, healthcare benefits, pay, and otherwise, and make that good decision going into the new year for their career.
Tim, thank you as always. Tim Aschoff, President of Shaffer, COO of Crete.